Hey everybody, it's Dr. Dave, Psychiatry. Today we're talking about bipolar disorder, which is a word that a lot of people use. Unfortunately, a lot of people using it don't know what they're talking about. So today is mostly about addressing misunderstanding, misinformation, what bipolar is and what bipolar isn't. Bipolar disorder is a serious medical condition that affects a lot of people, millions of people in America. And we have good chemical treatment for it, but it starts with an understanding. I don't like when people say I'm bipolar either. If you say you're bipolar, I don't like people saying to me I'm bipolar. And if you walk in my office and say I'm bipolar, I immediately say no, you're not. And a patient will say, well, what do you mean no, I'm not? I'll say, well, you can't be bipolar. And they say, what are you talking about, doctor? And I say, well, you can't be cancer. You can't be diabetes. You can't be bipolar. Bipolar is not an identity. You can have bipolar disorder, and we can talk about that. But do me a favor and don't say I am bipolar, because bipolar is not an identity. It's a medical condition. And I know that you want to say that you have the symptoms, but let's just start off with not saying I am bipolar, because you can't be bipolar any more than you can be cancer or be diabetes. Once we get across that bridge, the second question is, well, what does bipolar mean? And people have various definitions. Well, it's, when you fly off the handle and you get real depressed, and they describe different scenarios. And I say, okay, well, I understand what you're talking about, symptoms, but what does bipolar mean? And they typically say, well, what do you mean, doc? And I say, well, what does it mean? What does bi mean? And if they're stumped, I say, okay, bi means two, like bicycle means two wheels, and pole means side, like North Pole, South Pole. So bipolar just means two sides. That's all it means. Now, people can turn it into a big animal, and unfortunately, it's a very big animal in some ways, because I've seen situations where people were diagnosed with bipolar disorder and couldn't get life insurance because they were diagnosed with bipolar. It's terrible. I don't know how people get away with that. I don't know how companies get away with that. I guess it's about risk management and having a medical condition that they don't want to cover, and it is a medical condition. But it is a very stigmatizing and sometimes threatening diagnosis, which means you have to really be sure when you say that. I'm going to pull out my trusty white piece of paper and Sharpie and just talk about bipolar for a second chemically. 2 lines, the normal range, high and low. So when we're talking about two sides of a mood disorder, we're talking about people that alternate from being very depressed to being very maybe agitated, overthinking, accelerated. Accelerated meaning going too fast. And people do this, they cycle. Sometimes they get stuck in the low. Sometimes they get stuck in the high. Sometimes they have this condition called mixed, where they simultaneously have agitated, racing thoughts, grandiose thoughts, thinking too much, can't shut it off, and profound feelings of depression and low interest and not caring about stuff. So whether it's mixed, whether it's stuck in the high or stuck in the low, bipolar basically means two sides. There's the top side and the bottom side. That's all bipolar means. It's not a scary animal with, 3 heads and jaws of steel. It's just a two-sided mood disorder. Now, chemically, we have 2 approaches to bipolar disorder. Get a fresh piece of paper. We'll go back to the chemical diagnosis and what we do. High, low. The known mood chemicals, serotonin, norepinephrine, 5-HT being serotonin, NE being norepinephrine. If you're low on those, we've talked about this before. This is the downside, the depressive side. And typically, the other side is too much of a chemical called dopamine, which again, on the internet has been sort of misrepresented, because we're not talking about getting a dopamine hit from good music or good food or skydiving. We're talking about the part of your brain that uses dopamine to think, and if you're making too much, you'll think too much, and sometimes it's scary amounts of overthinking. Like, I think I'll drive to Los Angeles today because I want to get a snow cone at Malibu. and people will get in the car and do that. That's not good behavior. That gets you in trouble. So chemically, what we're talking about is a two-sided deal. So you can talk about bipolar being the two sides of the mood, bipolar mood, or bipolar chemistry. I tend to talk about the chemistry because that's what I want to fix. We'll start with the dopamine side. What we know is that people who make too much dopamine feel better when they take medicines that reduce dopamine. So today we have medicines like olanzapine, Zyprexa. You've heard of that probably. You might have seen a commercial for Abilify. You might have seen a commercial for Vraylar. Seroquel is another one. We have lots of we have a good, pretty good handful of medicines that push dopamine activity down, what I call dopamine suppressors. And if you want to go back to the troubleshooting brain chemistry video that I did, you can look at that troubleshooting and go through this in a little more detail. But those dopamine suppressors, that's the one side. They push down the one side. They push down the overthinking side. Typically with a patient like this, you're also going to have to do something for the sadness. That's where a little bit of nuance comes in. And if your doctor is talking about this, or if you're a doctor or anybody who's writing a prescription, I call you a doctor, if you're thinking about what to do next, one of the things we know from hard experience is sometimes when you use medicines that push up serotonin, like Prozac, Zoloft, Paxil, just to name a few of those. When you push up serotonin in a patient that's got the two-sided deal, which is what I typically call in my office, a two-sided deal. I just don't like the word bipolar. It just gets abused by people. I call it a two-sided deal. So if you got a two-sided deal and you're going to work on the bottom side, typically we rely more on the norepinephrine boosters, and the go-to product really is Wellbutrin. And the reason we do that is that patients who are stuck on the low side, Wellbutrin is a medicine that very often helps their mood and doesn't make this part worse, doesn't make the high side worse. Now, that's not a hard and fast rule. I'm not telling you what you should take. I'm not treating you. This is just educational. But this is how we think about it, and this is how I think about it. And the essential point is that if you have a two-sided deal, you're going to need two medicines. Now, the last thing to say about the modern approach to the two-sided deal is that and this I'll do without a piece of paper because I'm going to talk for a second about what are called the mood stabilizers. So these are medicines like Depakote, Trileptal, sometimes Tegretol, and if you want to, you can WebMD search those and read about them. But the point is that these medicines are essentially anti-seizure medicines that calm down cranky nerve cells. That's what they're designed to do. So they change the electrical potential of nerve cells and calm them down. So if you're having a seizure and the outside of your brain, the nerve cells are firing, and you got to get them to stop, well, we use medicines like Tegretol and Depakote and Trileptal to calm those down and prevent those episodes by keeping those nerve cells from being too cranky. The inside part of your brain, what I sometimes call the dinosaur brain, but that's not really accurate. The point is that you have parts of the internal part of your brain that control how you sleep, how you, your interest in food, your interest in sex, your interest in your general motivation. The internal, old, I tend to call them dinosaur part of the brain. When those parts of your brain get cranky, not the outside thinking parts, when the inside parts get cranky and they start to misfire, guess what happens? Mood swings. So the parts of your brain, big names, hippocampus, hypothalamus, limbic system, when those parts of the brain get irritable and cranky, we use the seizure medicines, we borrow those from neurology to help those central parts of the brain be less cranky and calm down, to take this and turn it into this, hopefully. Now, one of the good pieces of news is that you can take those anti-seizure medicines. You can take Depakote, Trileptal, and Neurontin, any of those, at the same time that you're taking these medicine, one of these medicines or two of these medicines here as well. So you can layer that treatment onto there. And if you have questions about that, talk to the person that writes prescriptions for you. But I just want to give you the sort of the basic approach to this. And if you're a treating physician and you want to know more about this, obviously leave a comment, and hopefully I'm able to help people understand this a little bit better. If you struggle with this, with the two-sided thing, man, it is just another deal. It is a two-sided deal. It's not good. It's not good to have a two-sided deal, but honestly, in my book, it's not any worse than having a one-sided deal. Just something you got to take care of. And if you're struggling with it, if you're not sure how to approach it, if you're not sure what to do, like I've said in other videos in this YouTube channel, raise your hand, ask for help, walk into somebody's office and say, look, I think bipolar is a model that I want to explore. And hopefully you'll be in hands of somebody who will help you. I hope this is helpful to you today. If you have a friend struggling, I hope that you share it with them. Thanks for coming to the channel. Please subscribe, as I've said before. If you subscribe and like, if you like what you're seeing, that pushes this content to the top of the pile for the algorithm and helps other people who you will never know, who might search this and get the information that they need today as opposed to a year from now. So we hope that you do that. This is fun. Thanks for being here, and thanks for coming to see me.